Hi folks, this is Dr. Rob CYWES. I am the carb addiction doc. I am a clinically practicing surgeon. I am also not only working in the ketogenic space in terms of giving guidance and advice, I'm actually an operating surgeon. I'm a clinical surgeon. I operate on patients all the time. I do some bariatric surgery. There's other videos on that. But the other thing that we do from time to time, and I'm not a plastic surgeon, is we do some skin surgeries. However, that is not my primary vocation, but this video is going to be about excess skin. And it's so common in my practice that patients who lose massive amounts of weight, 100, 200 pounds, have excess skin. So let's talk a little bit about that. One thing you got to understand is that if you're obese, if you're heavy, you've stretched your skin. And that skin is, by the way, for most humans, your skin is the largest organ of the human body. The skin is the largest organ in the human body. It is a dynamic, functional entity. So it's not just this protective barrier. It's not just a bag, a plastic bag that keeps you intact. It has function all the time. For example, that's where vitamin D is made, through sunlight. So the skin is a functional organ, and it's a stretchy, elastic organ. And the older we get, the more that elasticity breaks down. So as we become fat, depending on how genetically we deposit that fat, some people have fat everywhere, from their scalp to their toes. Some people, the lipedema patients, just have a large amount of fat in their butt and their thighs and their legs, not the ankles. And then from the waist up, not as much fat. Some people, mostly the men, have these huge bellies, these barrel bellies, and they look like an avocado pip where you've shoved a couple of toothpicks in the bottom and they've got this big avocado pip on the top. So there are different morphologies of where we deposit fat that is hormonally and genetically directed. But when we lose that weight, that skin that is stretched either over our whole body, over our legs and thighs, over our belly, over our arms. Some people carry that bat wing on the arms. Some people carry it in their jowls. That excess skin stays there. Some of it shrinks down with elasticity, but for the most part, you've now got a half-inflated balloon, and of course, there's going to be extra skin. So what do you do about it? First most important thing, there is no gimmick, there is no wallet biopsy, there is no magic supplement that will do anything to your skin. Do not buy into and spend a lot of money on all the BS that's being sold to you on the internet, or buy all these doctors with magical skin cures. Cindy Crawford has beautiful skin because she is genetically been gifted beautiful skin. It isn't because of the crap that she smears on her skin. She's just selling stuff for money. She could be rubbing poop on her face. She'd still be gorgeous at whatever age she's at. I think she's my age. So the point is that don't be a victim of buying a whole bunch of product. Now, if you enjoy it, buy it. If you've got extra money, buy it. But don't think it's going to do the magic that is promised to you. It won't. It won't. Okay? Keeping your dry skin a little bit moist, that's a reasonable thing to do. But thinking about all these anti-aging, oh, this is in it and that's in it and it costs you $1 million, not so much. Okay? And I will argue with any of the anti-aging docs about that. And they'll show you pictures of these wonderful, okay? That's the general gist of it. If you've got the extra money and you're involved in it, fine, spend your money. Everybody's got to waste their money one way. You're not taking the money where you're going in the end of all of this. However, those gimmicks do not work. So if you've lost that weight, you're going to have extra skin. I've lost nearly 100 pounds. I've got extra skin. Everyone's always so fat in these videos. This is my jowls. When my neck was out here, that's the leftover. I've got some here. I've got some here. Fortunately, my wife doesn't mind. She accepts me for who I am and not who she wishes I would be. So I'm very fortunate that Janae is okay with my body the way it is. Do I keep working on my body? Of course I do. I try to tone it up. I try to work with it. So when you've lost that weight, the first option you have if you don't like your skin, gain the weight back. Start eating carbs again. Because when that balloon reinflates, your skin will stretch out. But here's what you do. Fat people don't look at themselves because they conveniently ignore how fat we are. We see the vital parts. I see my face, I see my hair, but I ignored my entire fat body. Because if we saw it, we'd have to do something about it. And it's amazing how we distort the reality of our own obesity so we don't even see it. Quite incredible. And then when we lose the weight, now we're looking at every little piece of us and oh my God, I got a little bit here, I got a little bit there. Because we're starting to love the journey and we're starting to become more self-engaged. So we see the things we don't like about ourselves more acutely. We go and examine ourselves in the mirror. The fat guy never looks at himself in the mirror because they don't want to see, they don't want to know. So you become more aware of it. Most people are not that aware of it. And even if they're slightly aware of it, they're tolerant to it. But if you're intolerant to it, there are do's and don'ts when it comes to this. I've already addressed all the creams and potions and lotions and wallet biopsies. You can use them, you can waste your money, but in my opinion, they just do not work. They just do not work. They don't give you the promised results. Then there's this whole category of very transient strategies, these magical strategies, somewhat interventional, cool sculpting, liposuction, all of these things that are designed to shape you. And really what you're buying into is the pitch of a very slick plastic surgeon that's selling you something. Remember that fable about the emperor without his clothes and how wonderful everybody told him he looked, even though he wasn't wearing any clothes? That's the job of plastic surgeons. They're there to tell you how wonderful you look because of what they did to you. And they're there to sell you stuff. That's what they do. They upspeak, they upsell. And I'm not opposed to them. I do some of this work myself. I think there's huge value to a good plastic surgeon. But you've got to drive that ship. You've got to tell them what you want. You don't want them to tell you what you need. You've got to tell them what you want. You don't want them to tell you what you need. Very important concept. And if it's too good to be true, it probably is. I mean, that's a standard statement. So the single best thing that you can do for your excess skin at a starting point, whether you're going to have plastic surgery or not, is number one, don't have cosmetic surgery of any kind too early in your weight loss journey. You're wasting your time, wasting your money, and it's probably going to have to be redone. Wait until you stabilize. And there's something else you want to do in that wait period. But wait until you stabilize before you have the skin surgery done. If you're a young woman, have your baby first. Get pregnant first before you have your skin surgery. Unless you need to have the skin surgery to get the man to have the baby. Okay, that's a different story. But wait, don't have it done too early. The second thing, and the most important thing of this entire video, get your ass in the gym. Start working out. Target body areas. Target your abdominal muscles. Target your leg muscles. Target your arm muscles. Develop and exercise and get fit in the muscles that underlie the skin that you hate the most. Work that out, and it takes months to maybe a year or two to get that right. Work that out. Get the muscles right. And I'll tell you why. Sometimes the muscle turgor and that physical activity shrinks a little bit of the subcutaneous fat. And you can actually, especially if you're young, the tissue integrity is good enough, you can actually shrink that skin down so that it is not that ugly and so that you can live with it, especially if you like the muscle and the skin is not too bad. Okay? The second thing is, even if you still need the skin surgery, you are giving your surgeon a better framework with which to work. I love my patients with great abdominal muscles to do their tummy tuck. If they have no muscles on their tummy, it's just this floppy bag, and the results are awful, no matter who does it. So give them tissue integrity that they can then work with, strengthen that muscle underneath, Strengthen that muscle underneath. So they're doing skin surgery, not fat surgery. By the way, that's also an important point. Lose all the excess weight that you can. This is skin surgery, not weight reduction or fat surgery. You put enough money on a table, a plastic surgeon will cut you anywhere you choose to. And that's, again, it's not an indictment. That's unfortunately the way the business works. Sometimes it's not in your best interest to have a lot of fat cut off with your skin. It's poorly vascularized, the infection rates are high, the deformation of that skin down the road is horrible. It's not going to look that good. You want one shot at this and you want to give yourself the best shot possible. And you notice that I'm looking at surgery, removal of the excess skin. And we're talking not about somebody who's lost 5 pounds and has a little pooch on their belly. We're talking about people that have lost more than 80 to 100 pounds that have massive amounts of excess skin. Surgery should be your primary objective, to cut away that extra skin, and then remodeling can happen with some liposuction. Now, I don't do liposuction, but most plastic surgeons do, and you want some lipo to modify not the global fat that's left. You want to lose that. But the liposuction is there genetically for little deposits. Some women have a little bulge right on the side of their hip. That's appropriate for liposuction. Some men have a little bit of extra boob. That's okay for liposuction. But not global fat reduction. It doesn't work that way. This is for the genetically redundant little deposits of fat. But skin surgery with a little bit of liposuction to modify that is a great way to go. And then make sure that you interview multiple plastic surgeons. They'll all have a great speech. They'll all want to capture you before you leave. They want to seal the deal, get your money on the table before you leave the practice. So when you go in there, keep an open mind. Say, listen, I've lost a lot of weight. I'm interested in skin surgery. What do you think? Keep it very open-minded, because you're going to go and see 3 or 4 of them. The visit should always be free. If they charge you for a visit, at least here in the US, do not go and see that surgeon. If they charge you for the visit, do not go and see that surgeon. Remember, if you're going to do this in any healthy way, you're going to be paying for it out of your own pocket. You're going to be paying for this out of your own pocket. It's very, very rare that good surgeons will take money from the insurance company, because the insurance companies just don't pay for it. So remember, you're going to pay for it out of pocket. It's your money, it's your experience, and you want a good result. So leave the question, I've lost a lot of weight. I'm interested in having some skin surgery. What do you think? What would you do? Ask them if you can record the visit. Ask them if you can tape record the visit. If they say no, that's a red flag. That's a red flag right there. They should be comfortable speaking on the record. Okay? Don't do that. Don't tape them quietly. Announce to them, is it okay if I record this visit? That's important, okay? Because you want that record so that you can discuss it with them, not to hold them accountable, not to sue them. That's stupid. That's stupid in healthcare. But you want to be able to have that discussion. You want to remember what they said. It's for your empowerment, for your knowledge. Having said that, let them speak. Don't you tell them what they have to do. All too often, you have to do this and you have to do it this way, and I read on the internet. No. You want the surgeon to engage you in a trusting way. They're the expert. Let them tell you what they're going to do. And if you hear the same story from 3 or 4 different surgeons with differences, you can then decide for yourself which one fits your needs the best. But if you tell them what you want and you micromanage their opinion, it's your opinion, it's not theirs. You're not going to learn anything from a visit. So have them outline exactly what they're going to do, exactly what the outcome is, and also make sure that they tell you about the risks, the benefits, and the recovery. What's the risk of infection? What are you going to do if my wound falls open? Because 25 to 30% of the time with these big, massive surgeries, that happens. What are you going to do with my belly button? What are you going to do if I get an infection there? What are you going to do with my scar? How do you manage those things afterwards? Can I do my boobs and my tummy at the same time? Oh, no, you shouldn't do that. What about my tummy and my arms, or my boobs and my arms, or my legs and my arms? Can I do those at the same time? Where's the scar going to be? Those are questions you want to ask. And my advocacy is always do the boobs before or at the same time as the tummy. Don't do the tummy first. Don't do the thighs and the tummy at the same time. Do the tummy first. You can do the arms and the tummy, but it makes mobility very, very difficult. So do one body part at a time if you can. Yes, it's more expensive, but the recovery is better. Remember, your body has to handle the massive injury that is plastic surgery. We basically skin you, then pull the skin down and reattach it. Ask them about drains. Ask them about liposuction. And then once you've interviewed 3 or 4 on the record, have them show you photographs of their work. Then you can also do a price comparison, and then you can make your decision. But remember, you're in the driver's seat. Skin surgery is excellent. It gives us a great cosmetic result. It's never quite as good as you imagine it would be, but it's usually a hell of a lot better than looking like a Shar-Pei dog. I know that's a little saying that I have, but it's true. So you've earned the right. You've earned the right to have your skin, your tummy tuck done if you've lost the weight. But be sure that you've waited long enough, number 1, to strengthen your underlying muscles, number 2, to review and interview the doctors correctly, and number 3 is to make sure that your weight loss behavior pattern, that the behavior pattern that you've changed is consolidated enough that you're not going to gain the weight back. I see so many people put the cart before the horse, where they have the skin surgery and then regain their weight and they look awful. Don't be that person. This is the final tidy up. You deserve it. You're worth it. You've put the effort in. Do not look back on it, but make sure you are patient. Make sure you do it right. Help your surgeon to give you the best job possible. And it's nobody else's business. It is nobody else's business. If you want your boobs done, that's fine. If you want your arms done, that's fine. If you want your thighs done, your tummy done, make sure that it is your business. But if you've had massive weight loss and you're really worried about that skin, have it cleaned up. But also ask the people that you care about around you if it bothers them. And my wife has said repeatedly, I love you the way you are, and I love the way that you work at improving yourself. You don't need to do anymore. And if that's the case, then I can learn to love me the way I am too, and work at it. But I don't need skin surgery. And you know what? If you trolls out there tell me about my chin or whatever it is, I'm proud of this, because I got a neck again. When I was fat, I didn't have one. I am the Carb Addiction Doc. I hope this helps. Let me know your comments. The best way to see us is text us at 561-517-0642. Text us, WhatsApp us, or call us, leave a message, and we'll reach out to you and set up a visit. If you want a first opinion, a second opinion, we can do that. If you look at the show notes below this, all that data is in there. All that information is in there. Good luck, and I hope you learn to love yourself before you have your skin surgery.